Did you know about jaw Botox? Today I've got Anna with me. She's amazing. She works super hard. It obviously means that sometimes she can get stressed and she can clench her teeth, which is I think what's happening. Is that right?
Yeah.
As a result, she's got pretty big muscles down here. Now this muscle is called the master muscle and you can see how it pops every time she clenches her teeth. So today's treatment is going to be trying to reduce that activity with Botox. Botox is the brand name for botulinum toxin. It is a toxin that's been used for a very long time to reduce muscle activity and to weaken the muscle over time. When a patient like Anna comes to see me, we do an assessment first. So I'll take a history typically. I'll want to see how it's affecting her, whether it's the appearance that she doesn't like or whether it's actually putting strain on her jaw and she's waking up with an achy jaw in the morning. All of these reasons are great reasons for getting jaw Botox. So Anna, what is the main reason that you want to have jaw Botox today?
Definitely have been clenching my teeth and sometimes I wake up and it feels really tight and tender, but also you can see it's quite big.
Exactly. So with these injections, we can actually reduce the size of them. They'll shrink down, but it's not like the Botox that you would get for wrinkles, for example, in the face. It does take a little bit longer to work because we're waiting for the muscle to not work at all. And therefore, over time, when you don't use your muscles, they get smaller, they start to shrink. So it can take up to 6 weeks to see the results. And then as a side effect, she will also have a face slimming effect, which I don't think you mind. Yeah, amazing. So I'm going to make up the Botox and then you can see how I do it. Obviously, initially we need to know where we're starting. So we start off by taking some pictures. Okay, so just normal, that's amazing. We'll do side pictures as well. And I just want you to clench for me, please, and relax and clench again. That's great. This is the teeny weeny bottle of Botox. You can see brand name right there and it looks empty, but actually if you can see the white powder at the bottom there, that's the Botox itself. So we're going to make it up with some saline, which is basically salt water. Into here, straight in, and then we listen for the hiss, which means that there's a vacuum inside there. Like that. And then we just mix it about. Then we're going to draw it up again. Tricky to make sure you've got every drop. Blow out air bubbles. Then this is going to be my injecting needle, really tiny but long enough to reach the muscle. That's all ready. I'm going to take this over. Right, Anna, ready?
I'm ready.
Just clench again for me. Great, so I can feel it super strong exactly there. And clench again. Perfect, so it's there. So I'm just marking out where I feel the muscle is. So it ends there. Now, if you inject too close to here, you can start to affect the smile. So I need to make sure that where I'm injecting is far away from the muscles that control the smile. So give me a nice big smile for me. Okay, relax. Smile again. That's it, perfect. So here I'm quite safe and we can do a few injections. Some people do 3 or 4, but I like to do 1 or 2. That way you're reducing the risk of affecting any of the other muscles that we don't want to do.
Get some cheekbones back.
Yeah. So we just disinfect first. Okay, clench, relax. Good. Good. Perfect. How did that feel?
Fine.
Okay. Done. So super quick treatment and hopefully it's going to be really effective. So we'll check back in with you in 6 weeks to have a look at the result. So that's it. How did it feel?
Absolutely fine. You can't feel the needle go in. And then the way I would describe it is if you had like a knot in a muscle, someone just pushing on that. So light pressure.
Yeah, literally seconds and it's over. Amazing. If you'd like to book in for any kind of facial aesthetics assessment or maybe you have a problem with jaw clenching, then give us a call or send us a DM.